Hello, everyone. Today we're joined by Dr. Morrison and Chief of Nursing Marion Dowling. I'll just start very briefly at the beginning by saying that I know that in the last 48 hours we've thrown a lot at you in terms of new information and protocols, and we will be taking the time over the next little while to clarify much of that and updating our website and Q&As, etc. Knowing, of course, that these are very challenging times and encouraging everyone to stay united by staying apart. This circuit breaker is necessary for us to help stop the spread of COVID in our province. Certainly wasn't a decision that we wanted to make, but it was a decision that we needed to make, and I just wanted to say that I really appreciate the response from Islanders. The response since the beginning of this from all Islanders has been positive and supportive, and I think we see that today when we look at the response to testing, etc. I think Islanders are eager to do their part, and we certainly appreciate that. Islanders take the new and all health protocols and measures very seriously, and that is a tremendous asset for us as we continue in this ongoing battle with COVID-19. Our response has been rapid from a health perspective with the new measures that we put in place, talked about yesterday, put in place this morning, but also those we put in place earlier. We're doing everything we can to act as quickly as we can from a health perspective, and I'm proud of the effort. Our response for those who are directly impacted by these new measures will be swift as well. Minister McKay and Minister Hudson will be having a news event later on this afternoon to talk about the government's assistance that will be rolled out for those who are impacted, and that will include employees, employers, nonprofit organizations, food banks, and social assistance clients as well. So emergency funding was included in the spring budget under the COVID contingency plan. Those funds were put in place for this very reason, and as we have done from the very beginning, we will act swiftly to help those Islanders who are impacted, and we will help them immediately. Also, I know there's a lot of questions, a lot of uncertainty, but I would be remiss if we didn't remind Islanders to follow the public health advice, wash your hands, wear a mask, stay socially distanced, download the COVID app. If you have symptoms, get tested, and to be mindful. So we asked you on Saturday to dig deep a little bit longer. We need to double down, and I would continue to encourage that. And also encourage all Islanders to remain focused, to remain calm, and to remain united, and that is how we will get through this. So with that, I'll turn it over to Dr. Morrison to begin with their COVID update.
Thank you, Premier. Good afternoon. So today really is a brief update on COVID in the province and some additional information and clarification on the testing for 20 to 29-year-olds in the Charlottetown area. And so we'll really be focused on these two areas, and I'll be available tomorrow to address other important issues, including the COVID-19 vaccine. Today I'm announcing 4 new cases of COVID in P.E.I. These cases include a female in her 20s and 3 males, 2 in their 20s and 1 in his 30s. None of these cases have a history of recent travel outside the province. These new cases are all close contacts of the cases announced on the weekend. Contact tracing is underway, and all close contacts will be tested and required to self-isolate for 14 days, regardless of their test results. At this point, the source of the outbreak is not known, and it is still under investigation. As of this morning, we have 14 active cases in the province, and we have had 84 cases of COVID-19 since the pandemic began. There are no new additional public exposures to report today. Given the demographic of the current outbreak, it is important that we increase testing of the individuals aged 20 to 29 to tell us if COVID-19 is circulating in this population that might otherwise go undetected. We do know that some people with COVID-19 do not display symptoms of this virus, yet they can spread it to others. So additional testing over the next week will provide us with valuable information about the presence of COVID-19 in this age group. So anyone in any age group, but particularly those in the age group 20 to 29 with symptoms should go get tested. But we also know that this virus spreads easily among people in closed spaces where there's close contained contact. Hence, it's especially important that individuals aged 20 to 29 who live with others in the same age group be tested for COVID-19. So I am recommending that individuals in the 20 to 29 age group who live in the greater Charlottetown area be tested for COVID-19 sometime this week, even if they do not have symptoms. But they do not all need to be tested today. I know Health P.E.I, and Marion will speak to this, has set up additional clinics and extended hours of testing across the system, and there'll be an additional clinic in Stratford, and those clinic hours will be extended in other communities. Individuals in this age group that do get tested and are not close contacts of a confirmed case, and they do not have symptoms, will not need to self-isolate while waiting for their test results. As I mentioned yesterday, the sharp increase in cases in the past 48 hours and the fact that there is no connection to recent out-of-province travel is very concerning. I continue to be worried about what is currently happening with COVID-19 in our province. The circuit breaker measures that came into effect this morning are important in helping to break the chain of transmission and contain the spread of COVID-19 in the province. I understand these measures are challenging and an inconvenience for Islanders, and they impact each and every one of us. But if we do not act now, it may take us longer to recover, and we will have more devastating impacts for individuals, families, communities, and our island society as a whole. We hope these measures are very time limited. I am again urging Islanders to work together and practice the public health measures we've had in place to keep us all safe. As the Premier mentioned, wearing a non-medical mask, physically distance, wash your hands regularly, stay home if feeling unwell, downloading the COVID app, and most importantly, going to get tested if experiencing symptoms of COVID-19. As we continue to support one another through this global pandemic, please consider what we've gone through in the last 9 months. We have continued to be patient and kind, and I think some days are harder than others. But as we go forward in these next few weeks, please, let's continue to be patient and kind to each other. Thank you.
Good afternoon, everyone. We have been working closely with the Chief Public Health Office to ramp up staffing and expand the testing clinics to meet the needs of Islanders based on the recommendations coming out. We appreciate that today there are long waits for some people waiting to receive their swabs, as this segment of the population are being asked to be tested, and it's a large number of individuals. Please be patient as our staff at the testing clinics and the labs are working as hard as possible to expand our capacity to test. The people attending these clinics may have to wait in line for some time, and you can expect to wait for up to 72 hours for negative test results. The new hours today for testing clinics are as follows, and these will be posted online. A Stratford testing clinic located at the Stratford Town Hall is open now and will continue until 8 p.m. tonight. The Montague testing clinic located at the Montague Legion will continue to be open this afternoon until 4 p.m. The Summerside testing clinic at Slemon Park will be open at extended hours until 6 p.m. this evening. And the O'Leary testing clinic at the O'Leary Health Center opened early this morning at 10 a.m. but will close today at 4. The Charlottetown testing clinic at Park Street location will be open today and this week from 8 a.m. until 8 p.m. The testing clinics do have processes in place for individuals who come to the sites without a vehicle, and individuals should follow the direction of the staff on the site when they arrive. We are also working with Holland College to set up additional testing clinics at their Charlottetown campus, and this would be a walk-in clinic for individuals who may not have access to a vehicle, and individuals can take the transit to locations for the testing clinics as long as they do not have symptoms. For those individuals who do not have transportation, the best option for you is to request a test through the online booking system, and the clinic staff will contact you directly to arrange testing. We have made some changes based on the public health measures announced to begin today and the new restrictions, and as of 8 a.m. today, there's no visitors permitted at any Health P.E.I. hospitals, long-term care, or other facilities. Exceptions are made for compassionate circumstances, particularly for end-of-life situations for our patients or residents. Patients or residents may have a designated partner in care with them, and a partner in care is a family member or friend who helps provide additional care for that patient or resident and are considered part of that patient's care family. Our pediatric or newborn patients are able to have more than one parent or guardian with them if receiving care in our facilities. These restrictions are difficult for our patients and their families, but they are very important for us during these next 2 weeks as we work to urgently limit the spread of COVID-19 in our community and to any of our healthcare services. Service delivery at Health P.E.I. remains unchanged at this time, but we are actively evaluating the services within primary care and public health nursing in particular, as they are supporting the majority of our testing, contact tracing, and preparation for vaccine. Further updates will be provided if any of our health services change. I would encourage everyone to continue to monitor the government website and the public notifications we will be sending out with respect to any testing clinic hour changes or expansion. Thank you.
Well, thank you both very much. I do appreciate how quickly those in our health system are able to be so flexible and fast and nimble and to respond as needed. And our last 48 hours are certainly a great indication of that. So thanks to both of you and your large teams for that. And with that, I will turn it over to questions from our friends in the media.
Julien Lecacheur, Radio-Canada.
Bonjour à tous. Bonjour, Dr. Morrison. Dr. Morrison, j'aimerais parler des tests. Est-ce que vous savez combien de tests ont été effectués durant la fin de semaine depuis que vous avez annoncé ces derniers cas? Et ensuite, à combien de tests par jour vous êtes capable d'évaluer, d'étudier, s'il vous plaît?
Bonjour, Julien. Je n'ai pas les numéros de hier, et peut-être Marion en a, mais samedi, il y avait 434 à peu près de tests qui ont été faits ici à l'île Prince-Édouard. Et puis, on est en train, on anticipe beaucoup de tests cette semaine. Et je sais que le laboratoire et les cliniques ont fait grand nombre, double de ce nombre dans les jours avant qu'on a besoin. Et j'imagine, si on a besoin, on va avoir les centaines de tests par jour. Et puis, on va regarder le nombre de tests qui ont été faits dans ce groupe de 20 à 29 ans. Alors, on va, chaque fois qu'on a les numéros, le nombre de tests, on va vous informer.
Docteur Morrison, autre question. J'aimerais savoir concrètement, est-ce que vous pourriez rassurer peut-être les parents qui ont des enfants dans les écoles? Vous avez décidé de fermer les écoles secondaires à Charlottetown pour des mesures préventives, mais pour les autres écoles, les parents ne doivent pas s'inquiéter. Ils peuvent continuer d'envoyer leurs enfants dans les autres écoles de Charlottetown.
Bonjour. La décision a été faite avec le département d'éducation. Alors, c'était une décision qui était partagée. Et c'était vraiment à cause de où on sait les cas, l'âge des enfants à l'école secondaire dans cette région. Et le mouvement de ces étudiants. Et puis, alors, je pense que Norbert Carpenter a parlé de ça hier aussi, la raison. Et puis, et c'était aussi dans ces grandes écoles secondaires dans la région de Charlottetown, ils ont la difficulté d'avoir seulement le nombre de faire ça comme cohorte très bien. Alors, les autres écoles, on peut faire ça de façon, je pense, un peu plus facile. Et puis, mais je sais que si on voit une raison pour changer cette décision, on va en faire. Mais à ce moment, j'envoie mes 4 enfants à l'école.
Merci beaucoup.
Kevin Bissett, Canadian Press.
Yes, good afternoon. Dr. Morrison, I apologize if you were already asked this question over the weekend, but can you explain why you've decided to take such an aggressive approach to the age group of people in their 20s, and do you foresee perhaps expanding that to other age groups?
Hello. So we've certainly seen the increase in the number of cases in that 20 to 29-year-old category, age group, right across the country, and that's really over the last couple of months. We didn't see that age group impacted in the same way in April and May, but definitely the number of cases has been and the highest incidence of cases in that age group. So when we started to see those, our cases increase here very quickly for Prince Edward Island in that similar age group, that we felt it's important to focus on that age group, but also we've learned from other provinces and even other countries that if you're going to make a difference in terms of trying to minimize the impact of COVID-19 and lower the transmission, it's important to do it hard, fast, early, and it will help your recovery and the time that you're able to recover, and also the time that you have to have the restrictions in place. So I guess those are a couple of reasons that we would proceed the way we did.
And a question for either yourself or the Premier. Pfizer has said that it would be able to start shipping vaccine quite quickly once it's approved. Are you ready to accept a Pfizer vaccine on the island, including having things like the freezers in place?
Yes, we are. And we've said at different times that we will be ready to receive and to administer, and we are looking forward to doing so.
Thank you.
Thanks.
Brian Higgins, CBC.
Hi, Dr. Morrison. First of all, could you translate some of the question from Julian LeCacheur, perhaps, or your answer about details on how many people have been tested recently?
Hi, I'll try and remember what I said. So I think the number, it was a question around the number of tests over the weekend. So I have the number for Saturday, which is 430 approximately. And I didn't bring any numbers from yesterday. It's possible Marion has them, I'm not sure. But we will be updating testing numbers going forward, and also looking particularly at the number of tests in that 20 to 29-year-old category. And we can compare that to our historical numbers in that age category to know how much increase we've had. And so we'll be doing that on a daily basis as over the next couple of weeks.
Yeah, I think the number of people trying to get tested, of course, is huge now. I'm trying to get a sense of what change in the number of people coming to the testing clinics each day? What kind of change in volume have we seen? Or can you tell us more about that whole ramped-up effort to do widespread testing, either staffing or the number of cars coming through per hour, things like that?
Maybe I'll start and let Marion finish. I mean, I think that testing strategy really started this morning, so I don't think we have a lot of hours to compare to, but I think Marion can speak to the actual process.
Sure. I can add a little bit just about sort of the capacity that we've created. So we know at the Park Street location, for example, we can take 12 vehicles into that bay at a time with 3 lanes going through. But of course, then it depends how many people are in each vehicle as to how many tests you get done in that short time. And then those vehicles are moved through very quickly and the next 12 will come in. So that's what we've looked at there. For our Stratford location, what we have created initially was 2 stations for people to come in and be tested there, and that's being increased as we speak, if it hasn't started already, to an additional 2 stations to increase the capacity there and try and move people through as quickly as possible. I think we've just seen, as the Premier mentioned, Islanders really respond to the request to be tested if you have symptoms or if you fit any of these categories, and people are paying very close attention to the public exposure advisories and are being diligent in their follow-up and careful to protect each other in our community. So we're working as quickly as we can to create that access to testing for people so that they know when they've followed up on those advisories, and we can do our part to contain any spread of the virus based on that.
And I think a lot of people are all of a sudden looking at the very real possibility that they themselves will be going through that drive-through lineup for a test. And I bet a lot of people are wondering, what's it like? You know, I bet they start to get sweaty palms thinking about a minor medical test. Could you walk us through what it's like to be in a vehicle going through the testing procedure?
I can try. I have been through the drive-through testing center myself in the past, so that the staff are extremely professional and organized, and I know I've heard nothing but positive comments from others who've gone through, even at busy times. So they have a very good system where people arrive in their vehicle, and you have your health card with you. Try not to bring your pets with you or other people in the vehicle who aren't needing testing. That is appreciated. We've had some friendly dogs and other animals in our vehicles. But that helps our staff be very efficient with gathering your information, entering it into our clinical information system directly at the sites with our partners with IT who set that up. And that helps everything down the line. So creating the labels for the specimens, getting your information based on our screening questions, answering questions from you that you may have with respect to your own personal situation as to why you've come to be tested, whether that's being a close contact, what are your requirements, and our staff will reinforce the direction that you are needing if you're required to self-isolate after your test, whether you're a rotational worker or all of those things. And then you would proceed along the line to the swabbers. The test is very quick and short, and the staff do an excellent job of getting your swab done and completed, again, answering questions that people may have at that point, and then you move on with your direction home. So it is very quick, very seamless, and I know the staff will do their very best to answer questions and get your information and then expedite those tests to our laboratory for processing.
And what's the swabbing procedure?
It depends on your age. So there are 2 separate swabbing procedures if you're an adult, which is a nasopharyngeal swab, and I should let Dr. Morrison answer these ones. And there's a different type of swab for young children.
Thank you. And how many people are now in self-isolation?
Yeah, I mean, I guess there's something called mid-turbinates swab as well. And just to follow up, I think I just wanted to take a second, because I didn't emphasize it before, that for those who are getting tested who do not have symptoms over the next week, it'll be really important that even if you're tested and your result comes back negative, if you develop symptoms, then a few days later, you need to go get tested again. That negative test is good, but if things change, you will need a test. And so I don't want people to count on the test they had a few days ago because it was negative. If they start to develop symptoms, they should go and get tested. Anyway, I think, I know there was additional questions there, but I think we'll be speaking about the numbers of people in isolation and operation isolation and close contacts tomorrow.
Thanks very much.
Okay.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. Pour commencer, est-ce que vous pourriez juste traduire en français ce que vous venez de dire à Brian, s'il vous plaît?
Oui, j'en pense pour pour tout le monde, mais en particulier avec les personnes entre 20 et 29 ans. Si vous allez pour faire un test cette semaine et puis c'est négatif, c'est tellement important. Si quelque chose change et vous devenez malade ou des symptômes, vous devrez être testé encore. Alors, un test aujourd'hui, c'est négatif, c'est une bonne chose, mais si quelques jours, peut-être vendredi, j'ai des symptômes, mal à la gorge, quelque chose comme ça, je devrais aller pour faire un autre test. Et puis, je voulais juste faire ce conseil.
Merci. Et alors, j'ai une question sur, là maintenant, il y a le circuit breaker qui est en place. Quelle est la dynamique que vous espérez? Si maintenant, demain, après-demain, il y a nouveau des cas, je veux dire, combien de temps, au bout de combien de jours, vous espérez que ça va baisser? Combien de temps ça va prendre pour que ce soit efficace?
C'est une bonne question. Et puis, c'est pour cette raison, le circuit breaker est 2 semaines, parce que c'est au moins 2 semaines qu'on a besoin vraiment pour voir que c'est un effet. Mais si on trouve, c'est clair, on a une source de l'infection et puis on sait qu'on a tous les contacts et on est très confortable avec ça, ça peut-être va changer, mais la plupart du temps, un circuit breaker a besoin de 2 semaines.
Merci, c'est tout pour moi.
Unique, The Guardian.
Hi, good afternoon to everyone. Just had a question to start for Dr. Morrison. I wonder if you could tell me a little bit more about the new cases, the new 4 cases. Are they all linked to the same exposure site at Wendy's? Were they all staff? Or some of them not staff?
So these 4 cases were all found because of the contact tracing of our other cases, and so they are all linked, but they are not all staff none of them are staff at, I don't believe any of them are staff at any restaurants or eating establishments.
Okay, thank you. And a question for Ms. Dowling. Excuse me. There had been some concerns, I guess, over recent weeks about the decision during the first wave to, close Unit 9 or transfer the services to a different location. So I'm wondering if the Joint Response Team has considered this and if there are plans, if there is a continuing surge of cases, to close Unit 9 within the QEH.
Hi, we are monitoring our service level, but of course our response right now is focused on the community. We don't have any cases in hospital. We have been monitoring the numbers of individuals coming to our cough and fever clinics, which continue to run, and I remind people in the public that if you do have symptoms and feel like you need to be assessed by a physician or nurse practitioner, that is an option for you with respiratory symptoms. And we have not seen an increase, so we don't feel there's an additional level of, I guess, acute illness or additional increased symptoms of people in the community that would be needing us to change our service level within the acute care sector at this point.
Okay, thank you.
Thanks.
Alison Jenkins, The Guardian.
Yes, hello. I have a question about testing by appointment. Is it still available, and what's the wait time like?
Yes, it is available, so people can go online to book their appointments, and there is a website there, and then the clinic will contact you directly. I know as of this morning, a number of people took that option, and so the staff were working hard this morning to contact those individuals to get their test scheduled. So that is definitely still an option to do the online booking for appointments.
Okay, perfect. Thank you. My next question is about public services. I'm reading the circuit breaker table there with the services and the precautions. Public services should continue serving the public by phone, virtual services, delivery, or pickup, or in person. It's not very specific. What does this mean for Access P.E.I. sites?
Access P.E.I, and I think there'll be further discussions. I know they've reached out this morning to the operations government group as well, but really, it is not changing those services. Access P.E.I, there are already services that you can do online already, for instance, applications for different services, but that service is also available in person, and I know that they have been putting measures, those public health measures in place, so that we would anticipate that and expect that to continue. So that part has not changed.
So no changes to services at this point?
No, I mean, we haven't stopped any services or recommended any services stop. Just consideration that where possible, those services, if you can access them virtually, or by phone, or delivery or pickup, whatever that case might be, certainly that is a good option, but it has not changed the in-person access to these services.
Okay, thank you very much.
Louise Martin, CBC.
Hi, good afternoon to all three of you. Dr. Morrison, I know you've said you're concerned because you don't know the source of the cluster and now the cases going forward from that. Can you definitively call this community spread by definition? And if it is community spread and you confirm that, what does it mean for potentially more restrictions in the weeks ahead?
So at this point, I just would say that I am concerned. We're still investigating these cases and looking at them. The fact that the cases to date are all linked is positive. It means that our contact tracing is working. And we look at other outbreaks, and I think I talked about this yesterday as well, that we look at outbreaks in other provinces where they have been able to have a lot of their cases linked and are able to then control that particular outbreak, even if they don't identify the source. So that certainly is something that happens other places, but we are still looking at and exploring every possibility of where this particular outbreak could have originated.
Okay, so sort of you seem a bit reluctant to sort of label it community spread at this time. Would that be accurate to confirm?
So I think how I tried to speak about it yesterday was that I'm concerned about community transmission when we have this number of cases and we haven't been able to link the source. But the additional testing this week, all our contact tracing may either reassure me or make me more concerned.
Okay, and are all the active cases in the greater Charlottetown area, Dr. Morrison? And does that, in a sense, make Charlottetown a bit of a hot spot for COVID-19 at this moment in time on PEI?
At this time, the active cases are residing in the greater Charlottetown area, but they do not all work in the greater Charlottetown area.
Okay, thank you.
And I believe that's it. So I want to thank both of you, of course, for, and I think you'll be back out tomorrow with your regular and more, if it's possible, more detailed update. But thanks very much.